program not exist any longer, because they really have done some wonderful state-of-the-art kinds of things that other states are doing, and some things that no other state is doing. So we're really happy to have you here. Stan Escalante and Patty Allison are our presenters.
Susan, you have done an excellent job at describing our program. Thank you. We're not going to try to ditto what Susan has done. Maybe we can share just a little bit different perspectives, because many of our services are exactly like Bryant's. In fact, when Bryant started, we've all worked hand in hand to make sure that our services are exemplary, because sometimes there's a misunderstanding about the services that school-based mental health offers. But I'm going to speak to you as a special education teacher and then a counselor for years in public school, and then a licensed professional counselor in both private practice and in coordinating the school program, and also as a special education supervisor. But bottom line, this is such a needed service in schools. And I think people who aren't in schools every day do not realize the benefit of what these people provide until you see it, until you live it and breathe it, the 7 to 10 hours a day that we do. You really can't get a hold or a grasp of what having someone right there on campus who can help our children with significant behavior and emotional needs. We're all in mental health. We all know the family issues. We all know what's going on with our kids in the homes. It's really sad. But when you can see a child that's in the alternative program with diagnosis, 4 or 5 of them, that are emotionally disturbed, they've been in 4 or 5 different residential facilities, their medications are changed numerously just to get them to be maintained in school, and to see them being maintained in school, to be on campus and have friends and go to classes and not go to a residential facility or not be incarcerated, really. It's amazing. I talked to the therapist that started our program back in early 2000, and it was one person that led the program, as Ruth has talked about, and she is not with us anymore. She stepped down when our funding decreased. She just stepped herself down and said, I'm going to step down. And she worked for a whole semester. Basically, she put almost $100,000 in therapists and case managers on her own. She was never reimbursed a penny. Her husband had been killed out here on Maumelle. And she tried to start her own company at that time, but no other RSPMI providers are going to be allowed to come in at this time. So she took the money she got from her husband's death, which was about $150,000. She allocated $100,000 to provide services to our kids. That was amazing. Our school-based funding had diminished us tremendously. She hired our case managers, she hired our therapists to keep those people employed. And with the money we got to keep 3. But you also have to realize we were serving also in our co-op area 15 other schools too that had therapists in them. So we had lots of schools, lots of kids. We were meeting monthly. We were talking and having town meetings. We were talking to legislators. We were talking to community. We said we have a key piece in mental health for children. And it's right here in these programs that we are offering. We believe in them. We believe in them. We know they work because we're old. I've seen it. I live it. I see what it does for our kids. It is an excellent program. A little bit about our program. Ruth, are you ready? And again, I'm not going to repeat because so much. Susan and all of us and Vicki, we've all worked hand in hand to make them successful. but our whole goal is to keep our kids in school. If I could put it anything, of course we're going to strengthen families and community, but we're here to keep our kids in school. Our staff today, as it stands, and our next slide, is these people, and a lot of times there's some misunderstandings. They think that we're not licensed professional counselors, or we're not social workers, or we're not school psychology specialists, that we're paraprofessionals, or that we're just had some mental health training. No, we are really full-fledged, pay our dues, and have worked hard to be there. So we do have a wonderful expertise of people who are working with us. Now Western Arkansas Counseling and Guidance is helping us too with Ben and Carol as licensed professional counselors and 2 case managers along with our staff. When you hear comments about when we send out our satisfaction surveys, we can just hear our comments from our school staff. I could have given you a whole bunch, but all of it groan and moan at the thought of not having a therapist in school. Stan asked me coming down here, we have a 3-hour drive, we have a lot of time to talk. He said, okay, I'm coming straight to the source. The assistant principal asked me yesterday, am I not going to be in her school? Am I going to be someplace else? I said, I hadn't heard that. Unless there's something I don't know. The principals value them so much. They're always saying, can we keep our therapists? And the one thing about our therapists is those that we've hired, they don't go away. We have them and they stay, and they stay. With my example a while ago, yes, they stepped down, some of them, to continue to provide services through Kathy's money, but they have stayed hooked up with us. There's not a lot of flexibility or moving around as they're staying. Comments by our parents, my goodness, you know them. They're just so glad that the services are right there at the school and we can help them. Our comments by the kids, these next comments are by our students who were kindergarten through 2nd grade. And they had lots of little things because they had to write them or they had to tell someone about it. And they wanted to stay there at least through 2nd grade. So they tell us a little bit about early intervention. Our types of functions provided and related, we have our response to intervention team. We meet weekly with our staff, with our principals, counselor, interventionists, school-based personnel, and special education. And as with Bryant, our referrals are made directly from those folks who have looked at every level of help and support that's been provided before they're ever referred to us. Our services provided, oh my goodness, we have so much, as you can see, and we have wonderful summer programs that continue on, sometimes with, again, kind of a straining budget, but our therapists stay hooked with our kids all summer long. Probably one of the most newest part of our thing is athletic life coach, and I want Stan to talk a little bit about what he's doing for another group that you might not think need help.
Okay, about 1.5 years ago, I was called over in the administration building and they asked me told me the need. There's actually some issues with some of the athletes with drugs, and they asked me if I would be willing to work with athletics. And like everything else we deal with, it all goes back to funding, and they said, we're going to tell you up front, there's a lot more time, but there's not going to be any money for it. So I said, yes, I would love to do it. So with my background as a counselor, and then also small country churches in the past pastoring, Mr. Cecil said, go over and see Coach, the athletic director, and talk with him. And so he said, I'm not going to call you a chaplain, I'm not going to call you a counselor, I'm going to call you a life coach. I'm not going to tell the athletes why you're here, you just get out there with them and they'll figure it out. I was thinking, I don't know about this. But it didn't take long for them to figure out why I was there. I'm working mainly with football, but trying to expand it to the other sports. We have a 24-hour crisis phone, and I've had guys call me at 2 o'clock in the morning. And you know, athletes are dealing with all the same things as just the general population. relationships with their families, with their girlfriends, with drugs, suicidal depression. And sometimes, I try my best not to be friends with students on Facebook. But there's one guy on football kept telling me, Mr. Escalante, you won't be my friend, you won't be my friend. So finally I did. So he had on there one Sunday afternoon, worst day of my life, I think I'll just kill myself. So I called him. I said, hey man, what's going on? He said, what do you mean? So I told him, he said, all the Saints lost. I said, well, my profession, you don't put that out there. But I hang out in the locker room with the guys. I'm on the sideline with them. I travel with them to away games. It does take a lot of time, but it's building those relationships, and then just on extra time after, like on weekend, on Saturday and different things, meet with them and some of their folks as seniors. It's amazing me how many parents still, even with all the things we have in place school, don't know how to get their kid to college. And then also, things like, when I talk about relationship, one of the guys, he and his girlfriend having a baby, and working with both sides of the families there, and just all kind of things that, if there's drugs involved, there's a minimum time that each of the athletes have to see me. As I said, we're trying to extend it into baseball, basketball, and then a lady who'd worked for FCA for 10 years, just on a voluntary basis. It's harder for me to work with the girls. You can't just go in and hang out in the locker room, but she is starting to work with the girls this fall. So that's something that Coach Ken Hatfield was down back in the spring. He asked me, he said, what kind of coach are you? And so I told him. He said, you're kidding. I said, no. He said, did you know that's one of the biggest demands on college campuses right now? You ever thought about going on college level? And I said, I didn't even know they have them. But he was talking about, he said, I can't believe that there's, it's in the high school that's available. And so it is something new, but it's enjoyable, and you can, we talk about it, if we can hit not just athletes, but all extracurricular, what my goal is to eventually see it reach out to band, choir, ROTC, ag, if you hit all those, you're going to be available to the larger percentage of the student population. And I said it's more just building relationships with them, gaining their trust. And talking about being on the sideline, I very seldom get to see a football game because there's always a guy beside my shoulder talking to me. And then, I know one of the last games, the trainer was actually talking to me, and finally she said, I'm sorry, we're both out here working. I shouldn't be telling you all my problems. And I said, well, that's fine. That's what I'm out here for. But it is a neat thing, and I know Auburn University has a life coach, but some of our competitors have asked about, have come and visited and talked with about getting it started. I know one of the Little Rock schools has visited with us, and so it's something hopefully we can grow on.
Our task force, we work, when we heard about system of care and we read and looked at Ginger Beebe's when she went across the state and looked at all of that, we really realized as a group that we were already a system of care. We were already connected with our community resources, with our medical profession, with our juvenile probation, with our Department of Human Services. Already in the school as a task force, we were meeting regularly, and we were working in that very same, we didn't have any monies connected to it, but we already worked with a, quote, system of care within our community. We went to the system of care training. We're all CCC members now, and I'm on the finance committee, even for CCC. It has given us another bigger area, because that's 6 counties, to look at all the resources that are available for our families. I go every month to that meeting and participate in that. That's been huge, because really we were doing it already in the small pocket, which was our school, but now we've expanded it on, and now we're working with 6 counties. But you would be surprised when we pull all of those people together how we can help each other. The next part is just our parenting classes. These are our parenting classes. They're ongoing. We offer it to our school. We offered it now to the CCC that they can send people to our parenting class.